Hi CAM followers, it's Esme here and I'm interviewing the lovely Samantha Lindley today. She is one of my big inspirations in what I do, so I will let her explain herself what she does.
Hi, thanks Esme, and thanks for inviting me onto this CAM meeting, and hello to everyone on the CAM followers site. I've been a vet for many years, 30 years. I've been doing acupuncture, which is what we're going to talk about today, since 1991. In those days, a pretty short course, which was a very good course, got me interested because we weren't given an awful lot of information about safety. And we had a lot of rather crippled Ayrshire farmers. So I treated a lot of them, which was really good practice. I'm not sure I'd have been quite as gung-ho these days as I was in those days. And that gave me a lot of practice in treating animals. Also, the farmers were really enthusiastic about me putting needles into their cows and their sheep as well as themselves. And that gave me lots of confidence in then going on to treat people's dogs and cats. So since then, I've become more involved in getting acupuncture to be, if you like, more mainstream in the veterinary profession, which I think we've succeeded in doing, very much focusing on the Western approach, so a scientific background, and involving vets in not only looking at acupuncture, but then using it very much in terms of pain and other treatments as well.
And you work quite closely with the British Medical Acupuncture Association as well, don't you?
Yes, my colleague Dr. Mike Cummings and I devised a course. He's been running a course along with the British Medical Acupuncture Society for many years, a foundation course for the medical profession. And I started off teaching on that, and then he and I decided that we should devise a similar course for vets and veterinary nurses. And so we did that, and we've been running that since 2001.
I think the big thing that I want to put forward in this conversation is how you've brought acupuncture from being this idea of sort of a alternative therapy, let's put it, to a conventional therapy with evidence base.
Yes, we'd like to think of, I think we'd now talk about it as an integrated therapy. So it's used alongside and very much woven in conventional medicine. So I use lots of conventional medicines and I use acupuncture. Electroacupuncture is not even a traditional technique because it's using electricity and an impulse generator. So it's something that we incorporate very much into normal veterinary practice.
Yes. So the theme of today's talk, and we've kind of labelled it, why you don't need to believe in acupuncture, and the idea of this is just to discuss some evidence behind acupuncture, really, isn't it, and explain to people why they don't need to have a belief in it, or there isn't some kind of spirituality behind what we do as vets.
No, that's right. Traditional Chinese medicine is where people tend to get most of their ideas about acupuncture from, and it's a very ancient treatment, medicine, and in some cases philosophy and spiritually based medicine, and that's where people tend to get muddled up about belief and getting very much looking at some of the traditional ideas, which you could think of as in terms of a historical view of medicine, where we used to talk about miasma and bile and black bile as being causes of disease rather than the kind of results of disease. So if you like, some of the traditional Chinese medicine is a historical way of looking at medicine before we understood pathology and pathophysiology, yeah, and what causes disease. So now we know very much about what causes lots of diseases. We start from that basis and then look at what acupuncture does in terms of its interaction with the body. And the more we learn about the neurophysiology of what happens with acupuncture and how the needles interact with the body, the more we understand how acupuncture works.
I think it's really important that we talk about that, the mechanisms, because it's fascinating listening to the history of acupuncture and how it's been used over thousands of years. And I know when I was doing the course with you that we spent a little bit of time on that, and it's absolutely amazing when you're going back to caveman times and they've found all sorts of fossilized bodies with evidence of acupuncture, and all of that's ridiculously interesting. But what I think is more interesting now is understanding how acupuncture does work on a scientific level, on a physiological level. And I wondered if you'd mind going into that in some detail.
Yes, in terms of how it works?
Yeah.
Yes, evidence about it. So the evidence has been gathered over years and from different sources. But essentially what we're doing with acupuncture, the very simple explanation, when we're treating pain, which is mainly what we're talking about with arthritis, although inflammation is a big and very current interest in terms of the use of acupuncture. But let's talk about pain, because I know that's what most of the people who are looking at this will be concerned about, their pets in pain. Obviously fantastic if we can do anything extra for the inflammatory process going on. Another story. But in terms of pain, what we do when we put an acupuncture needle in is that we, if you like, fool the body and the brain into thinking we're doing something more serious than we are. And by doing that, we trigger the really powerful pain relieving mechanisms that we have already in our bodies and our brains. So the very first thing that happens when you insert a needle is that the fibers, the nerve fibers that get stimulated, because that's what we're doing, we are just stimulating nerves.
Yeah.
We stimulate, if we do it right, the nerve fibers that alert us, the ones that make you jump if you've burned yourself, or make you stop if you stub your toe in alarm. That very, very first instant where you think you're going to have damaged yourself, yeah, those are the nerve fibers we're stimulating. And the important thing about that is for that very first tiny fraction of a second, you don't suffer.
Yes.
You just stop and then wait. And that's because it's a very clever system which stops us continuing to damage ourselves. It makes us take our hand off the thing that's hot. It makes us stop banging our toe on the stone. It doesn't make us suffer.
Yes.
The nerves that we're trying to compete with, and that's what we do with our acupuncture, we try and compete with the pain, are the second nerves, are the slow fibers that come along after you've stubbed your toe and you're waiting for a fraction of a second, and then the sickening pain comes along. Yep. Those are slow pain fibers, and those are the ones that make us suffer. So what we try to do with our acupuncture is, so we start off, so we stimulate the fast pain fibers, and that message then goes into the spinal cord, where we modulate, where we moderate lots of input. Yeah. There is a system in the spinal cord for damping down the horrible chronic pain that we're trying to treat, and pushing on that new stimulus, the new important thing. Gosh, you might have damaged yourself here. We need to know about this. There's a system in the spinal cord for doing that. So we activate that system, and our acupuncture message then goes on up to the brain, where its primary function is to have an interaction with an area of the brain we call the limbic system. It's a very ancient system, and it's to do with emotion. And emotion is what is behind our suffering, how we feel about our pain, how miserable it makes us, and how miserable it makes our pets with arthritis. Yeah. So we know from what they call functional MRI studies, so everybody's familiar with MRI, you can look in the MRI to see which bits of the brain are stimulated by various inputs. And we know from functional MRI studies with acupuncture that the primary function in the brain of acupuncture is to deactivate, to calm down the limbic system. We know that limbic system is overactive. It's brightly lit up when you look at fMRI studies, showing that the limbic system is overactive when we're suffering, when we have chronic pain. And one of the functions of acupuncture is to help calm that down. We also have other effects in that we release endorphins from areas of the brain. We also release other neurotransmitters, serotonin and noradrenaline, and these come back down the spinal cord and calm down pain. So it's a multi-dimensional effect on pain, reducing suffering, reducing the input of pain signals, moderating the pain signals in the spinal cord, and activating systems we call the descending inhibitory pain pathways, which calm down all the pain. So we're calming everything down throughout the body, and that's really how acupuncture works. We basically, as I say, fool the brain so it pays attention to the area. This is the endorphins, the chemicals, and all the mechanisms that we have for reducing pain on the areas in which we put the needle.
And I think it's really obvious when you're doing acupuncture, because you actually physically see the change in dogs or cats, but I think dogs are very, very visual on how they show that relaxation process. And I don't know, you've probably got lots of examples, but I have a dog called Bear who I treat, and he's different now, he's used to me, but when he first used to come, he would bark and bark and bark and bark, and he hates the vets. And then the second I put one needle in, that was it. Oh, oh no, I like this, and then straight to sleep. And then as soon as I take the needles out again, barking, barking, barking again. And I think it's such a visual response as well. It's really powerful for the owner and for me as well to see that.
Is really powerful, and that's that sedative response we get from the release of endorphins, but probably other neurotransmitters as well, oxytocin and prolactin, and those things that make animals feel really relaxed. And you're right, it is really powerful to see an animal who's either very wound up or very frightened or very anxious become deeply sedated. And we can then say to owners that in those cases we know that those animals are going to be good responders.
Absolutely.
If they don't become relaxed, you can't say that they're not going to be a good responder, because they may respond at the time. But we know when they get sedated like that, because they must be, because they have released those chemicals very quickly.
And what other things do you look for when, other than just going to sleep, when you're physically watching a pet have their acupuncture? Are there certain signs you look for to know that maybe this is going to be a good responder?
Sometimes they'll lie down.
Mm-hmm.
Quite often at the end of the month, there'll be a little drip at the end of their nose. They're salivating a little bit more sometimes, so they look very relaxed. Those are really the main signs. You can often see that their eyes are getting very heavy, and sometimes you'll see them try to fight it. They look as relaxed, and then they'll get a bit agitated because they don't, it's particularly in the early stages, they don't want to become that relaxed at the vets, because it's a place where they've been worried before. But as you say, as time goes on, they often then they see the signals, they understand the cue that this is what happens to them when they see you or me, or in a particular situation, that they're going to have this acupuncture experience. They're not going to have any other unpleasant experience, and they start to relax much more quickly.
And that's that process of conditioning, isn't it? And the animal associating a certain process or a person or a room or whatever with the treatment that you're doing, and actually that's providing some sort of routine, and therefore the start of the treatment is so much easier because the dog's ready for you and ready to get relaxed and actually starting to engage all those processes on its own without even popping a needle in yet.
Absolutely, and animals condition extremely well and extremely fast, and we will see, and you've obviously seen this, patients who have had only 1 or 2 treatments, and when they see the particular person, and particularly if it's the same room, or you go through a particular ritual, giving them a treat or petting them or using a particular rug, even wearing a particular kind of scrub top, that animal will not only start to relax and become sedated, but as you implied, they actually will almost certainly be starting to give themselves pain relief at that time. So it makes the process much faster, much more efficient.
Yeah, and lovely, and so nice to watch them go so relaxed. Yeah. So you touched on pain management, but there are other ways that acupuncture can work, and we were talking a little bit about anti-inflammatory processes. What other conditions do you think that acupuncture is useful for, or do we have evidence for?
Well, in humans, we have lots of evidence for other conditions. Before, we had evidence for the pain conditions, and pain is hard to measure because it's emotional component, so it's hard to measure convincingly. So before we had the evidence about the treatment of osteoarthritis of the human knee, for which we have very high levels of evidence that acupuncture works, and that's obviously relevant for people looking at this site. The best level of evidence we had was actually for post-operative and post-chemotherapeutic nausea and vomiting. We had very high levels of evidence that it works for that. We're still not altogether sure why. Partly endorphins, partly serotonin, partly distraction, and maybe other techniques as well. Effects on the autonomic, the parts of the nervous system about which we don't have control. We also know that it works for migraine and chronic tension headache, which is obviously pain related, but it's a very different kind of pain that we don't fully understand, and a very difficult kind of pain to treat. So hay fever. So that's an inflammatory and allergic condition. It works for that. Some conditions relative to dry eye, those sorts of things. And inflammatory conditions, we don't have necessarily the whole picture in terms of clinical inflammatory conditions. But after a study which was recently presented in Nature, the interest has been very much on anti-inflammatory effects that may be given by acupuncture. In terms of sepsis, perhaps having an effect on autoimmune type conditions. Of course, there's a big interest in that, not only at the moment, but also widely, because these conditions are so difficult to treat. And it appears that acupuncture has an effect through a major part of the nervous system called the vagus nerve. So the acupuncture effect that I was discussing, as it goes up to the brain, it stimulates the vagus nerve, and the vagus nerve has then other effects on other parts of the body, which can help with inflammation.
Interesting, isn't it? And I know that in my own practice, I'm now very convinced by its use in feline cystitis, for example, and we've had many discussions about that and how and why it might be working, and I've used it a lot in cases of diarrhea or post-op pain. So it is a really, really useful technique to have, and something extra in the armoury, and I very much use it as part of my treatment protocol. I wouldn't use it as a sole treatment. I'd still use what's known as a standard protocol, but it's great to have that as an extra, particularly for those post-op patients who are really uncomfortable and maybe not wanting to eat, and you've already got them on loads and loads of medications, and then when you put in your needles and they suddenly want to eat some food and they seem much more relaxed, it's very rewarding, and it's nice because you're not adding another chemical into the pharmacology you've already given them.
Yes. Yeah, that's right. And as you know, trying to incorporate acupuncture into the normal part of the practice is something I'm very keen on promoting, rather than it being a mysterious thing that you have to prepare for and do in a darkened room with whale music.
Yeah.
Just another tool. And as you said, because it's stimulating normal processes, and it's doing what we refer to as normalizing, if that doesn't sound too weird, it normalizes processes in the body. So if you've got diarrhea, then depending on the cause of diarrhea, it would tend to make that diarrhea settle down. Similarly, if you had constipation, doing exactly the same thing with the acupuncture would help ease the constipation depending on the cause. Yeah. So if you've got perfectly normal bowel function and you do acupuncture, nothing will change. Overall, nothing will change. And that's a great thing about it, because, as you say, you're not adding more medication, you're not confusing the picture with additional side effects. So on top of a normal protocol, it can be really useful.
Definitely, very, very useful. And as a GP vet, to have it as a part of your armoury is great, because you've got that extra that you can offer to owners, especially ones who are worried about the amount of drugs you've already popped the pet on, or whatever that case may be. So yeah, very useful tool, and it's nice to have some evidence behind it all, which is kind of the focus of this topic, really, isn't it? So going on from that, what evidence do we have? And I think if we focus on arthritis, because I know there is loads of evidence for acupuncture out there and it's very broad, but if we sort of concentrate on arthritis in particular.
Okay, well, let's start with the bad news. The bad news is there is very little evidence overall in terms of veterinary clinical conditions in acupuncture. Now, that's not because it doesn't work, although you could make that argument because we don't have the evidence, but because of the same reasons that we have a very low level of evidence for quite a lot of veterinary clinical conditions. It's hard to get the numbers. The big difficulty with arthritis is that it's not what we call a homogeneous condition. You can't, even if you took 100 arthritic dogs, you are not going to be looking at 100 dogs who have exactly the same condition. Some of them may have one joint, some of them may have multiple joints affected. Some may be in very little pain. Others may be in a state of what we call central sensitization or secondary sensitization, where the pain is so wound up they are painful even just to touch or stroke them. Yeah. So that's not the same as comparing it with a dog who may have multiple joint arthritis, but is running around and being quite happy as it is capable of being.
And it's an all-encompassing description, arthritis, as well, isn't it? Because even on just on a functional level, you're talking about the joint capsule, the bones, the cartilage, the nerves running through it, the inflammatory process. So even if you've got the same dog, you've got 5 10-year-old Labradors, all with just the left fore elbow affected, each of those elbows is going to be different as well.
It wouldn't be a homogeneous condition. So you need many, many numbers of patients. You can't, and you could not get that homogeneous population because you can't ask them. You can do as much assessment as you want to. You can use force plate, which is about the force that goes through when they put the pressure on that limb, although that doesn't measure pain. You can do pain scores, and there are validated pain scores, but people will argue about those. You can look at various measures to try and get as homogenous a population as possible. But generally speaking, when you have these kind of populations, what we tend to rely on is numbers, and the difficulty of getting large numbers of animals into a veterinary trial is one of the problems we have with assessing any veterinary treatment. So that's one of the difficulties. There are some studies out there. There's a negative study that Kapatkin et al. Did on elbow arthritis, but it was just in 9 dogs. And as you know, because we discussed it on the course, some of the dogs had multiple joints that were problems, and they were all taken off their pain relief before they went onto the study. And there were various issues with that study. What was interesting was the owners, who were what we call blinded, so they didn't know whether their pet was in the part of the study where they were getting acupuncture or in the part of the study where they weren't getting acupuncture. But 8 out of 9 of the owners guessed when their pet was getting acupuncture because they were happier, which is interesting because that's what we know acupuncture does. It makes animals happier. It doesn't necessarily stop them limping, because the joint may not be in a state where it's ever going to allow the animal to walk normally. It doesn't necessarily make them put more pressure through a force plate. What it does is make them happier about the pain they have. And when we have a chronic painful condition like arthritis, which we cannot cure yet, then our important thing to do is not to think about cure when we know we can't do it, but to stop the animal suffering. Yes. We want them to function as well as possible, of course, but we primarily want to stop them suffering. One of the difficulties is in measuring problems like chronic pain is because people are suspicious of emotion. They don't like measuring emotion because it's emotional and emotive and subjective, and we can never 100% know an animal's emotion, but we can measure their behavioural changes, and their behavioural changes indicate to us how they are feeling. And that gives us a measure of how much the problem is bothering them. Yeah, so measuring chronic pain is difficult because of the emotion and because a lot of the changes are quite subtle. Yeah. Compared with acute pain. Acute pain is relatively easy to measure, but the changes that our pets show, and your people who are watching this will know that, changes are very subtle. So when we ask questions, when you and I ask questions to owners of, does the dog get up to greet them? Or are they a little bit jumpier about noises than they used to be? I had an anaesthetist, and they're very much used to dealing with severe acute pain, sitting in with me, and he looked a bit strange and said, it's all very nuanced, isn't it? It's all very subtle. Because to us, the answers are massive. Yes, the dog is much jumpier. No, he won't get up and greet me anymore. To us, that's a massive change. Yeah. But people who are used to animals vocalizing and the heart rate going through the roof and respiratory rate going through the roof, these are very, very subtle things. So to try and plug them into a scientific clinical study, it can be very difficult.
So we're trying to measure the pet's welfare through their emotional interpretation of their pain, really, aren't we? And that's such a complex thing to understand, let alone test.
Absolutely, and because just like people, every dog's and cat's emotional change with pain will be different and individual to them. So there are some dogs who actually become more manic about exercise, more manic about play. They want to do more when they're painful, whereas we would assume they want to do less. But some of them will be, sometimes it's breed dependent as well, but obviously temperament dependent, that they will play more or want to exercise more. If you're very observant, you might notice a difference in the way that they do that, but sometimes they just want to exercise more.
Do you think that's a distraction thing, or do you think it's because they're really endorphins, or
kind of breeds like Springer Spaniels who have long learnt that high levels of exercise give them high levels of endorphin, and they do it to distract themselves and take their mind off the pain, I think, but obviously very hard to know.
Yeah. Okay. So are there any other issues
with
doing studies?
We've got issues of what we call blinding, and I referred to that. And what we need to do when we do any kind of study is to make sure that we're getting the best test of the actual insertion of the needle through the skin. That's what we want to test.
Yeah. So
if we are applying this to a group of animals, we need to have two groups of animals, one we're doing this to and one we're not doing it to. But both groups of animals need to have everything else applied to them except the needle going through the skin, because there are so many things when we interact with our animals. We cannot compare 20 dogs sitting in a kennel with 20 dogs coming into a consulting room being interacted with and having a needle put into them, because there's an awful lot in terms of that movement. The consulting room, we just mentioned all those emotions involved with that, the interaction with the animals. As soon as we interact with, particularly with our dogs, we trigger emotion, or we trigger emotional change, and even just by touching them nicely, we can release some of these neurotransmitters that I've talked about. So we then have to do everything to both groups of animals but put the needles in. In order to measure the effect, we have to have two groups of people. We have to have somebody assessing how they're doing in terms of somebody clinical who doesn't know whether they got acupuncture or not. So the assessor is blinded to the treatment. But the owner also needs to be blinded to who had the treatment, because as soon as the owner knows that their pet was or wasn't in the acupuncture group, that changes their attitude. And all your owners will know that their attitude changes. And a lot of people will know at the moment, the situation we're in at the moment, a lot of them are picking up on the strangeness, the change of routine, the anxiety of their owners. So you're more upbeat because you think your dog's had acupuncture, then the dog gets a little bit more upbeat.
Oh, why are we so excited, Mum?
And who knows that that doesn't have an effect on their pain? To some extent it probably does. So we have to blind the owner to the fact that their dog has acupuncture. Now that's straightforward, great, easy. We just remove the dog from the owner. Well, again, a lot of people watching this will know that some of their dogs behave better when the vet takes the dog away from them, or do they behave better, or are they actually just a bit more worried? And some of them are worse and do much better when the owner's there. And one of the things that we know about anxiety, when you are very anxious, you release a chemical called cholecystokinin 8, and that counteracts the endorphins that are released by acupuncture. So if you have a very, very anxious animal, which you may well do if they've been taken away and put in a kennel, because they'll have previous experiences of that, or taken away from the owner generally by the vet, then the animal will become anxious, may release this chemical, and that may then counteract some of the effects of acupuncture, meaning that it apparently works less well. And if you've got small numbers and you're comparing taking a dog into a room and being nice to it and touching it, and taking a dog into a room and being nice to it and touching it and putting an acupuncture needle in, if you've got very few numbers and you've got some of the effects counteracted by this anxiety effect, then you're not going to see very much difference between the two groups. While it all sounds like making excuses for why we don't have studies, these are real problems that we have.
There's no point doing that study unless you know that it's going to be a good quality study with good evidence. So it's difficult, isn't it, getting around those issues?
It is, and some of them would be got around if we had very, very large numbers, because those animals who were so anxious that they were going to counteract the effects, if you divide them between the two groups in large numbers, they would even out.
Yes.
Small groups, you only need to have one or two outliers in one group or the other to really skew those effects. So that's the bad news about the clinical veterinary situation in terms of studies. We have lots of experimental studies in animals, so we know that acupuncture works in animals, particularly in rats. If you have a painful rat, acupuncture is the thing to do. Works well in and rabbits, and there are many studies in dogs for various different conditions. These are experimental studies, though, which is not the same as having the clinical picture. We have to be aware. They do a thing in studies called modeling. So they try to produce, say, an animal model of arthritis by injecting something pretty horrible and irritant into, say, the knee joint of a rat. And then they start to do studies on it. And in terms of the knee and the pain in the knee, that modeling is probably quite good. What it doesn't necessarily do is, of course, it shows all those chronic adaptive changes in behavior that we see with our dogs with osteoarthritis. So again, we don't have that part to measure, but we know that acupuncture works in lots of these studies. Probably, I think, more convincing is the studies on the arthritis of the human knee. We know the knee is very vulnerable to arthritis. It's a very difficult joint to treat, which is why so many people end up with knee replacements, because it's taking so much strain and so much pressure. Yeah. So it's particularly impressive that we have evidence up to the level of what we call systematic review, which is the highest level of evidence, which usually comes out as there isn't any evidence one way or the other, but we actually have positive systematic review for osteoarthritis of the human knee. That's done using electroacupuncture. So that's electrically stimulated needles. It's a very potent form of acupuncture. And in human medicine, we have this number called numbers needed to treat. And that means you get a given number of patients, and you can assume that if you've treated that number and you haven't had a response, you really ought to be looking at what you're doing and how you're doing it. Yeah. So the NT for osteoarthritis of the human knee with acupuncture is 3. Some people would say that it's as high as 2. So in other words, you really do expect people to improve with arthritis. So these are people who have severe arthritis. Some of them are heading for knee replacements, and we know that acupuncture works for that. So that's an arthritic condition, painful, debilitating. To some extent, we have the emotional issue as well, because one of the parameters that clinicians use to decide whether or not people are going to go for a knee replacement is how much the pain bothers them. Does it keep them awake at night? Does it have significant impact on their life? And that's the emotional measure as well. So we know that works for arthritis in humans.
And that's something that's really important that we work out in dogs, isn't it? That how much the pain is bothering them. So how important is it, and how can we make it less important to them?
Yes, that's the problem with that's the aim of treating chronic pain, is to stop them suffering, stop them thinking about it. If you cannot cure a problem, then you need to stop them thinking about it. People very much think about, oh, pain is useful, we should be aware of pain. In terms of acute pain, it is useful. We do need to be aware of it and pay attention to it. We still need to treat it though, but in chronic pain, it isn't useful at all. And I still have owners saying to me, but I'm really worried if we make him feel better, that they'll run around and hurt themselves. Again, well, that's not a reason for keeping an animal in pain. Yeah. And that's your responsibility to stop them running around and hurting themselves. And we need to find ways of allowing them to be dogs and moderating and modulating the pain and suffering that they have. But we don't use pain to limit it. And mostly for most of these arthritic dogs, we don't get rid of the pain altogether. They are still limited in what they can do. But of course, excitement and adrenaline and the postman coming will still make them want to tear down the stairs, slide across the door and smack into the front door and hurt themselves. But one of the things that we often find with acupuncture, and again, this is obviously anecdotal and not evidence, but from a scientific point of view, we do know that acupuncture starts to build up the release of more and more endorphin. So it's a little bit like a vaccination in that there's more endorphin, more pain relief there ready. And I don't know whether you've heard other owners say this, but I've certainly heard it in the past, that when the dog does do something, oh, it chased a rabbit, and usually after it had done that, it'd be crippled for a week. And then they say, oh, so it took off after a rabbit last night. And I thought, oh, that's it. That's going to be really bad for a week. And they were a bit stiff. They were a bit stiff last night, but after that, they seemed okay. And that's one of the things that we hear. So acupuncture does seem to be building up that, if you like, resistance to pain, because the endorphins are there ready to respond. And that's one of the things that we do know. That's one of the reasons why acupuncture can last for a period of time after we've done the treatment, because we have this pool, if you like, of endorphins ready to react to the pain.
Yeah, I think that this is a slight tangent, but I think it explains a lot as well why I think one of the negative side effects, I'm going to say, to acupuncture that I see in my pets is that they suddenly become naughty again. So I often hear owners say, well, you didn't tell me he'd start jumping up and stealing things off the side again, or she started shredding the post again, and she hasn't done that for 4 years. And I think that's that sort of reserve of endorphins, the want to play is there, they're feeling happier, they feel like they can do that jumping up onto the side. They'll do that even though they know it might be painful, because they can cope with that pain a bit better.
Yes.
Which isn't always a positive for the owner, but it's lovely to see in the dog.
Their wonderful training had done the job, and in fact it was the poor animal was sore in the first place. But I think then people do really realise the emotional impact that the pain has had up until then.
And I think it's that change, because those naughty things have gone away very slowly. So you don't even know that your dog's got worse in that period, and then suddenly he's doing that again and think, oh God, he hasn't done that for such a long time, I forgot he even did it. So it's nice to hear that too.
Yes, but it does highlight the fact that so many people think that their animals are just getting better behaved. They're getting older, they're getting calmer, they've learned not to do things because they're just more mature, and then they realize that wasn't the case at all. You thought your training was brilliant. Sometimes it might not be about your training, it might be about the animal's pain, which is of course not a positive thing.
Yeah, absolutely. So we've got quite good quality evidence really then, although we're having to extrapolate a little bit from human medicine. I think what's I'd just like to highlight here is we talked in such great detail about the fairness and the lack of bias in a study, and that we're not using anecdotal evidence, although that for us is quite powerful. Personally, my evidence that I gather from all the cases I see, it adds to my own feelings and my approach to different cases, because you learn from it. But in terms of talking about whether acupuncture is something we need to believe in or not believe in, I think when you've got this powerful evidence that's scientific, it's fair, we're getting it from a lot of sources, it shows that it's not a belief system that you need to have. It's a fact, and it's a body's biological and physiological response to a treatment that we're giving.
Yeah, absolutely. We know that it works. We know it works in certain conditions. We know it works. We know how it works in many cases, and we're learning more about that all the time.
Yeah.
And there's Mike Cummings, who I mentioned earlier, keeps an updated record of all the studies, the experimental studies, the clinical studies, animal studies, human studies, on a database, and I think anyone can access that on the British Medical Acupuncture Society, and it's a very useful resource for where colleagues are being a bit grumpy about whether acupuncture works or not, and usually go, okay, read that. We go, okay, then that's really quite a lot of evidence that it works. So you know that acupuncture, it would be great. We really need the studies that say, yes, it works in canine arthritis, because that is probably the most common treatment, that and some spinal conditions that we use acupuncture for. It would also be useful to know the kind of percentage it works. So if we had an equivalent of numbers needed to treat, because that would mean that we could say to owners, look, there's an 80% chance that your will improve, might improve a little, might improve a lot. And also for our own sake, that if we treated, let's say we treated 4 or 5 patients and we thought, well, it doesn't seem to be working very well, and yet I was told on the course it worked really well for arthritis, that if we had that basis of evidence, we would then question ourselves rather than the technique to say, well, what is it we're not doing right? Have I assessed this animal wrongly? Am I not doing the acupuncture properly? Do I need electroacupuncture? Have I just been really unlucky? Maybe the owners aren't feeding back the information I'm expecting.
Yeah.
So particularly with things like elbow arthritis, and a lot of people watching this will appreciate this, elbow arthritis is very difficult to treat, but it's also difficult for owners because a forelimb lameness is so obvious and so annoying and so persistent. Hind limb lameness, many of our animals, and I'm sure you now watch lots of dogs when you're out and about, oh, back legs aren't good. Hind limb lamenesses tend to be ignored for long periods of time, and they then exacerbate forelimb lamenesses as well. But this forelimb lameness is there, and it really annoys people.
Yeah, having this real head bob, and they, and the dog can really look sore with it as well, can't they?
Sometimes you come to a conclusion that actually that elbow is never going to be any better. It's never going to move any better. And elbow replacement may be the answer if that's the answer for your particular pet. But it can be difficult to demonstrate to the owner sometimes, and they do eventually get it, that actually when I started treating your animal, your dog, it was pretty miserable and there was pain everywhere. And now actually they're much happier. So stop looking at the limping, because I'm now telling you that actually they're not suffering as much as they were before. But when it's really understandable when the owners go, yeah, but I want that head bob to go. And sometimes they need to look around and appreciate that there are other things. So if we had that evidence, it would also make us look again and say, well, actually, maybe my owner is looking at a different outcome measure than I'm looking at. And actually, I can palpate this animal, I can examine this animal and feel they're much less painful than they were. And you're telling me all sorts of things like they're bringing a toy, which they haven't done for ages. Or they're shredding the post, or instead of just plodding around the walk, focusing, not interacting, they're now stopping and sniffing and wandering off to do a little bit of interaction. But these are all things, yes, they're still limping, but they are limping more happily than they used to be limping.
And then that's more of a functional problem rather than a pain related problem, which at the end of the day for the dog is not as important. The pain is and the suffering is important, but as long as they can function and do all the things they want to do and you want them to do within reason, then that's a great outcome.
Yes, but of course you do need to have all that single patient evidence to be able to say that confidently to owners as well. Got us to digress slightly off the point, but in terms of if we had that evidence, it would help us to be more, rather than just going, oh, well, obviously it hasn't worked, help us to be more analytical about each particular case and say, well, why? If 80% of these are supposed to get better, why am I not getting better? And is it maybe I'm not looking at the right outcome measures? Perhaps I'm just basing too much on, because that's what we're trained to do as vets, basing it too much on the obvious lameness that we're seeing rather than those emotional changes. And unless we can point that out to owners, then owners aren't necessarily going to get that either. Some of them will get it sooner than we do, to be fair. But yeah, we need to have that evidence ideally in order to have that background help.
Yeah, absolutely. So let's talk more broadly about acupuncture then. So in terms of what type of patients are appropriate to treat, who can we treat and who can't we treat?
Technically, you could probably treat almost anybody. We would obviously be concerned about animals who are very, very anxious, partly for that I discussed that their anxiety may block some of the effects, but I wouldn't be over worried about that, because some animals look very anxious when they go into the vets, and that's been reinforced, and they may look an awful lot more anxious than they actually are. So I certainly wouldn't just say, oh, they're too anxious to give acupuncture to, because I've seen very anxious animals who've relaxed almost immediately on needles being put in. So I'd be cautious, but I wouldn't dismiss it. Very aggressive animals, of course, might be difficult. Again, you may start off with them muzzled and then you end up not having to have them muzzled at all. They may also be good responders. And some of that aggression is a learned response to being at the vets. The other animals that we need to be careful about are those animals whose pain system has got itself into such a state of up of central sensitization where they are very painful to touch. We need to be careful about giving them acupuncture because they might find the acupuncture painful. So for instance, if your vet assesses that your dog has that degree of pain, they may either say, look, we need to use a drug to wind the pain down before we can do acupuncture. Then that may well be what you have to do, and that goes against the grain with some people because they wanted the acupuncture, not to give the drugs. But that's not what we use acupuncture for. We don't use it to avoid drugs. We might use it to limit some of the medication, and we do it to improve the overall outcome. However, some of those animals who are very painful, what we have to remember is that the fingers with which we palpate have a much bigger surface area than the needles that we put in. So just because the animal seems to feel the pain a lot when we palpate them doesn't mean that they will feel the same way about the needles. Yes. So it might be that you can use very fine needles very cautiously, initially away from the most painful areas, and still get a response. So I used to be much more black and white about it than I am now. I used to be much more likely to say, no, you never do that, always give them medication. But now I will try, and some of them will respond well. And I think that's really a measure of the fact that we are not measuring this degree of pain in a scientific way.
Yes.
You can get these things called von Frey hairs, and you can test whether an animal has true allodynia, which is where they might respond to something like touch as pain. Now, when we're trying to make that assessment with our hands, it's crude, it's not particularly accurate, and we can. There are lots of reasons why an animal might move a limb away or tremble when we touch it. And that, one of the reasons might be that somebody has wiggled that joint around many times before, and the animal knows it's going to hurt.
Yeah.
And so they react, excuse me, as though it's painful before you even got there. That doesn't of course mean that it is painful. So you may see that if your vet's doing acupuncture on your dog, that they tend not to go immediately for the most painful area. You as an owner are thinking, but his elbow's sore, why don't you stick needles in his elbow? We tend not to do that. We tend to start away from the area of pain and make sure that the patient is accepting it and is not finding the needles too painful, because what we don't want to do, and it is possible to cause more pain temporarily with acupuncture, and we certainly don't want to do that or cause them more suffering or put them off the treatment altogether.
Yeah. And then in terms of, so we've gone through sort of patients that you wouldn't treat, and I guess in terms of what we would treat would be most patients other than the ones we've discussed. But in terms of illnesses, what would and wouldn't you treat with acupuncture?
Well, we would treat acute pain. So all the things that you've talked about, so that's acute musculoskeletal pain and acute visceral pain, but obviously alongside all the normal protocols. So it can be helpful in terms of pancreatitis, both acute and chronic, and some of the gut problems, appetite problems. Arthritis is still, I would say, the most common reason that people come on an acupuncture course, that's what they want to treat. Spondylosis, spinal pain, disc pain, those would probably be the most common kinds of pain. We also treat a lot of muscle pain, so soft tissue, what your vets would call soft tissue injuries, where you get myofascial pain, that's the painful knots in the muscle. Those are very common, very widespread, and we find them a lot in our painful patients. And they often arise secondary to other conditions like arthritis, like spinal disease. And we might find that your dog's joint, for example, which you're concerned about, the animal still seems to be painful or lame. Yet when we examine the joint and the animal's been on non-steroidal anti-inflammatory drugs for a long period of time, the joint doesn't seem to be that painful. But what we often now find is that there is muscle pain around that joint that hasn't responded necessarily particularly well to the medication, and acupuncture can treat that as well as the pain of the arthritis. Is not all it treats. So soft tissue pain with or without an original cause, disc pain, arthritis pain. With some skin conditions, we would need to be careful with animals who have extensive infection in their skin, because we can introduce more infection by doing that, so we wouldn't treat those. We will treat animals with visceral conditions. So you talked about cats with cystitis. We also treat cats with bowel problems who can't empty their bowels terribly well. We treat some conditions around the eyes, ear infections, those kind of things, all as part of your general protocol.
Yeah.
I suppose in some ways there isn't anything I wouldn't treat in terms of a symptomatic treatment, i.e. trying to control the symptoms, but we need to make it very clear to owners that there are some conditions we're not treating to try and treat the condition. And I think probably one of the common ones that we see, a very sad condition of CDRM, chronic degenerative radiculomyopathy, which owners of German Shepherds know plagues that breed, and Great Danes, where the big nerves die back. As far as we know, we have no treatment for that, and people will often ask for acupuncture. Sometimes when we treat those dogs, they do very well, not because we've treated the condition, but because they have other underlying conditions, because German Shepherds, unfortunately, are also prone to arthritis of the hips and stifle, the knees. They may also have disc disease in the spine, and they have secondary muscle pain because they've been trying to stabilize their wobbly spine. When we use acupuncture and those conditions improve, it often looks as though the animal either stabilizes the condition or actually gets better. And then it's very important that we tell people that we're not treating the condition and they will still deteriorate over time.
Yeah.
So that's important. Similarly, if we're looking at acupuncture where patients have cancer, obviously very emotive.
Yeah.
If we are treating the apparent nausea associated with chemotherapy, or we're treating pain because the animal's had to come off its other pain relief in order to get chemotherapy,
yeah,
we are not treating the cancer. So it's more about where we're not treating a condition and we're using it as palliative or symptomatic control that's important for people to realize, because obviously, you know, people like to have hope in lots of these conditions.
Yeah, and I guess to some extent when we're talking about arthritis, we are managing the pain, and there may be some element of reducing inflammation, but we aren't curing a joint. We're not going to get rid of arthritis. What sort of questions do you get asked commonly at your pain clinic that you think would be interesting to talk about?
I think most owners are concerned. The two big things that owners are concerned about are, is my dog in pain and suffering, and mobility, because they're worried about mobility. I think one of the things that as vets we have to be aware of, but it's also worth owners reflecting on this themselves, since we're all supposed to reflect these days, is that some people, I think, talk about mobility because to talk about suffering. For my generation and above, not so much for young things, when vets talk about suffering, owners hear, and the next step is there's nothing we can do and they need to be put down. Yeah. So whilst I encourage people to be talking about the emotional aspect of pain, the suffering aspect of pain, it's important that owners realize that we're saying the suffering and there's something we can do about it. It is not, that is not the end point. And that's a big generational change since I've been in practice. And it's important that people realize that. So I think sometimes when people talk about mobility, they may be not wanting to talk about the fact that they're suffering. So, but what the other thing is whether or not the animal's going to be able to get back to full function. And I think for a lot of people, they've had incredibly active animals. And in Scotland here, we have these things called Munros that are mountains of certain heights, and there's a big challenge to get up and down them. And a lot of the dogs have done them. But the trouble is you have to remember that these dogs don't just do the Munro, they do the Munro 10 times with the fact the owner's climbing it, up and down, rocky. And these dogs, they love to be with their owners and they love the exercise and they love to be running about. And they've developed chronic pain problems over the time, partly, frankly, over exercise. And because of the way that they're made in the first place, because as everybody who knows about this site will know that many of our dogs start off with joints that are abnormal. And for a lot of owners, there's a big shock as to how you had an animal who 3 months ago was climbing a Munro with you and now doesn't seem to be able to walk the length of itself, as they would say here in Scotland. And that's a big shock. And we have to be able to explain to owners that he's never going to be doing another Munro. They have coped and got to the point where actually they can't cope anymore and they really need to be taking it much, much more easily. So will they be able to get back to normal fitness is an important question. So that's going to depend on the degree of arthritis, whether or not we're looking at an acute flare-up or whether we're looking at a degeneration over the years.
Yeah, so it's a bit of a challenge for the owner to get used to, one, a change to their dog, but also maybe a change to their lifestyle as well.
People don't like to not be exercising, and they don't want, and it's horrible to go out for exercise without your dog. Partly the dog may not cope emotionally with that, but the owners can't cope emotionally either, and it seems hard to go for a walk without your dog when you're used to doing that. So those are not so much questions, but I think issues that come up. The other big one is about medicines and whether or not the medicines are damaging the animal. And a lot of owners are an awful lot happier when we've spent time, I'm sure you'll find this, spent time explaining to them exactly what these medicines are for, what each of them are for, and that we will use them as much as we need to. But another big important point is that chronic pain is a chronic stressor. And we're all very aware of stress these days. And we all know the massive impact that stress has on our bodies.
Yeah.
We worry about non-steroidal anti-inflammatory drug and kidneys. That's the common.
Yeah.
Steroidals won't do anything to a healthy kidney. They might do something to a healthy gut, but they won't do anything to a healthy. Important to realize is that chronic stress, of which pain is one source, actually slows down your blood, makes your blood more sluggish and viscous, thicker. And that's the last thing we want when we've got kidney problems. So leaving an animal in chronic stress is far more dangerous to themselves and their organs in most cases than giving them the medication. But we like to minimize the medication, obviously, for all sorts of reasons. And some animals simply can't have the medication. They can't tolerate it because they've got inflammatory bowel disease or something like that. And so we have to look at other ways of treating them.
Yep.
So the whole issue of medication can become thorny and tricky. And one of the great advantages of having a lot of time to talk to people about these is that they can understand why we're using them, that we won't necessarily leave them on them forever.
Yeah.
We always try taking them off very, very carefully. Very important thing to remember. And again, a lot of people watching this will, I'm sure, have had the example of running out of their non-steroidal anti-inflammatory drug for their dog for a few days and thinking, well, it seems okay.
Didn't make much difference. Yeah.
I don't think they need this. Let's stop it. It's important to realize that when a drug's doing a really good job and the pain is well wound down, it can take up to 6 weeks for it to wind back up again.
Mm-hmm.
And you then get suddenly hit a month, 6 weeks later with a very painful animal who actually needs more medication to get it back to where it was before.
Yeah.
So just because the patient does well for a few days or a week off the medication doesn't mean they don't need it. But by all means, let that prompt a conversation about it. But make sure that you don't assume it doesn't need it. Some people, on the other hand, really notice when they've missed one dose. And that probably should also prompt a conversation, because if the animal is that close to becoming one dose away from being very painful, then it may be that you should be doing other things, and maybe worried about medication, adding in acupuncture, physiotherapy, laser treatment, those kind of things, to see if you can get that plane of analgesia, as we call it, further down, which gives you a buffer. Because if your dog has to come off their non-steroidal because they've got diarrhea, upset stomach, they've got to go on steroids for something else, then they're completely vulnerable to their pain coming back.
Yeah, that's really interesting. I hope what we've done in this conversation is, one, just show to the whole world how amazing you are, and you know how much of a fan I am. This has been so interesting, and I think the takeaway point that I really want to get from this is that that owners don't need to believe in acupuncture. There's so much evidence out there for it. There's loads more to do, but I think that's the case with pretty much everything we've got in vet med, unfortunately. But the acupuncture is a really effective treatment. It's an option there. It's in addition as part of a multimodal treatment for a pet. And the other part that I'd like to take from this, which I think you've kind of talked about quite a few times, is educating owners. And that's what CAM is here as a platform for, to explain to owners why drugs work and why it might be helping your pet and why the acupuncture works. And because the more we understand about what we're doing for our pets, the more we can do for them.
Yes, and I think that's one of the single most important things that we do. When people understand it, then everything becomes easier for everybody, including the dog.
Absolutely. So Sam, I hope you don't mind me putting you on the spot, but I'm going to do something we call 10 top tips. This is general tips for pets in how to manage their pain. So I'll go first. So number 10, try to manage your pet's weight. So we offer a free body condition scoring service on CAM, but that's something really important to work out how overweight your pet may or may not be. And that's something you can do with your vet, and then accordingly feed them, do the exercise, all the things they may need to try and keep them in that perfect body condition score. Number 9 from Sam.
Number 9 from Sam, be sensible about exercise. We all love to exercise our dogs and we love to see them running about. Think about the surfaces that they're running on. And one of my pet hates, I'm sorry if it's going to upset anybody, but there we go, is to see people running with their dogs attached to them on concrete. that they can't regulate their own gait and their pace, and you're getting a very constant, frequent concussion on the same joints, and that isn't good for them. So if you want to run with them, run on grass, and where it's safe to do so, which of course we're not supposed to be doing at the moment, have them off lead or have them on a long lead, as long as you're not causing a danger to anyone else, so they can regulate their pace and so that they're not pounding around on a hard surface.
Absolutely. My number 8 is to think about buying some really fun toys for them to play with at home that aren't high impact. So the Kongs, the licky mats, snuffle mats, lots of adventure type activity games. They're really great for dogs. They're good for releasing endorphins. They're good for keeping them busy. And it's a nice way to give them food and treats and splitting their meals through the day. Number 7.
Number 7, so I'm really the fun police, aren't I? So on that basis, ball checkers. Ball checkers, yeah, they look great fun, and I think they're all right with used sensibly. One of the problems is that they create a brilliant bounce, and these dogs that jump up and grab the ball on the bounce, whether it's thrown from a chucker or not, if you watch what they do, they twist their spine from the bottom of their chest and the lower back, and that impacts a short muscle that runs between the bottom of the chest and the pelvis, and it's what we call the sublumbar muscles, and they can become very painful. And you just watch next time a dog does that, they leap, they twist, and then they crash to the ground. And when they do that repetitively, they're not only putting repetitive impact on their joints, think about footballers, but they're also straining their muscles, and of course they'll carry on doing it because they're having fun. So be sensible about ball throw, use hide and seek games if the dog's already got arthritis, or small amounts of rolling. Some dogs are just happy to carry a ball around, and then every so often do a small amount of throwing. So be sensible about it. We tend to give our dogs a lot of driven exercise rather than allowing them to do their own thing where it's safe to do so.
Yeah, absolutely. My number 6 is to look out for subtle changes. So it can be something as simple as your dog's not sleeping in the same position as it always has done, or they used to follow you around the house and they don't do that anymore. They might not be limping, but any change in subtle behaviour could be a sign of pain, and that's a point where I would be thinking we need to talk to the vet. Number 5.
Number 5, think about how they get in and out of the car. So with the beauty of hindsight, we would train all our puppies, and those of you who've got puppies, train them now to use steps or ramps to get in and out of the car. It is such a pain to try to train them when they're older. Many dogs see a ramp as an obstacle, and I'm sure many people listening will have had this experience. They see it as an obstacle, they try to jump past it, they crash into it, and then they're never going to look at it again. If we train them as puppies to use a step or a box or a ramp, it doesn't have to be a ramp, and that's how they get it in and out of the car. Not only will it make life easier as they get older, and you can hope all you like that your animal's not going to have arthritis, but you can't know, and many dogs do, so you might as well assume they're going to. But also the very fact of trying to jump in and jumping out, all that impact on the elbows and the shoulders and the neck as they try and stabilize, as they jump out of the car, that repeated concussion is actually leading them to develop arthritis as well. So if you look at the way they get in and out of the car, and even if it means getting in the side of the car, as long as they're well restrained rather than in the boot, then so much the better.
Yeah, absolutely. So my number 4 is thinking about when you've got an older pet who needs grooming, try and find yourself an understanding groomer, because one of my pet hates is when I've had a patient really stable and then they've gone to the groomer and they've had a 2-hour session where they've been made to stand still to look perfect. I would prefer your dog to look shaggy and be comfortable than have stood for 2 hours and look show ready. So I think it's important to work with your groomer and to, if you can, split sessions or make sure they're nicely analgesic, so lots of pain relief on board before. And that's something you can either speak to your vet about if you think you need a little top up before, or work really well with your groomer to make sure you're not forcing your dog into an uncomfortable position for a long period of time, because that's a real pet hate of mine. So number 3.
Number 3, going on continue the theme of the older animal, beware the making your own diagnosis of your dog becoming senile.
Yeah.
We're all aware of cognitive dysfunction in ourselves and well, ourselves, yes, I speak for myself, our relatives and horrible, sad condition.
Yeah.
And if it does occur, we know that it occurs in our dogs, but it is very much what we call a diagnosis of default. In other words, when you have ruled out everything else causing the problem, you may think about the fact that it's cognitive dysfunction. The key word here is cognitive. Can they still think? If they can still respond to your commands and do everything normal in all sorts of ways, but they happen just to be up and about pacing around at night, it's probably not cognitive dysfunction.
Yeah.
Many animals will display signs of what would be regarded as cognitive dysfunction, particularly vocalizing at night, pacing at night, shuffling about, not wanting to be on their own, getting trapped behind things because they're painful.
Yes.
If you get behind a door and you can't turn around because your spine's too sore, then people sometimes interpret that as, oh, they've just got stuck in a position and they don't know what to do about it. And we tend to feel pain more at night when everything's quiet, when you're trying to sleep, when there's no other stimuli, maybe when you're away from your owners, which you've coped with fine for 10 years, but now you can't cope with it because pain is frightening and you want to have company and you want to have that reassurance and you just can't get to sleep. And so you pace around a lot and then you get diagnosed with cognitive dysfunction.
Yeah.
So do be aware that that kind of change of sign may well be about pain rather than about cognitive dysfunction. So get some help for it rather than assuming that it's just your dog getting old.
Yeah, I think that's, I'm a bit controversial because I think there's so many dogs that are overdiagnosed with this behavioural dysfunction. And I would say, I mean, this is just a ballpark figure, but probably 90% of the dogs that come with behaviours, to me, that come for a pain clinic and have been diagnosed with arthritis and have started on acupuncture, 90% of the things that they were struggling with improve because it wasn't to do with cognitive behavioural dysfunction in the first place. It was a pain behaviour. So you've absolutely hit the nail on the head there with that one. My number 2 would be feeding stations. I think that's often our kitchens are tiled or slippery floors, so we've kind of touched on that already. And having I like the little cheap doormats you can get, or some kind of mat around your feeding station is important because often, especially with the larger dogs, they're leaning down, their legs are splaying, and that's a real point where they can start to get painful. But I think a raised feeding bowl to the right level can be really, really useful. It's something I would seek guidance about rather than just buying if you're not sure. And I often like to just use a shoebox or something and test things out first before I spend a lot of money on something. But I think that's a really useful thing. There's some conditions where it's not appropriate to have a raised feed bowl, but in general, it can be really, really helpful. So I would reassess where and how you're feeding your pet.
And water bowls as well, and be very aware of the water stations, particularly if your animal is older and it's on non-steroidals. You want it to drink plenty, and if it's a long walk and it's hard work, they're not going to do it.
And your number 1?
Weather. We're coming up to the spring. So many animals do well in the sun with their arthritis, just as people do. Some do worse. So don't assume that the sun is always good and warmth is always good. And many animals in pain suffer with the heat more. They become hotter, has effects on the hypothalamus, which is the area in the brain that controls temperature. And so look at what your pet is doing. Are they lying on hard surfaces, odd surfaces, because there's a cool draft? Get down there, get down into that surface and see what is that area. Is it cool? And if it is cool, well, that's fine. But if you find that because they've been on that hard surface, they then have trouble getting up, or they're really stiff because they've been lying on a hard surface, then you need to find other ways of helping them cool down. There are cool mats, although not all dogs like them. You can cool the animal with a damp towel and then use a fan, which helps the water to evaporate, which helps them cool. Maybe move their bed to an area that there's a draft. Think about the features of where they sleep. Are they trying to be warm? Are they trying to be cool? And use that to guide you in terms of temperature. We all hate having the wrong temperature, just generally, but in terms of the effect on your pain, it can be quite profound.
Yeah, absolutely. I think that's a brilliant one. Thank you so much, Sam. It's been amazing to speak to you and learn from you and extract as much information as I can from you. I just want to point out that Sam has a wonderful website, Longview Veterinary Services, and she's actually a published author. If you're a vet, then this is a great book to have a look at. It's all about rehab and supportive care. Is there anything you wanted to add, Sam?
Just that on the Longview Veterinary website and the Facebook page, we're putting lots of tips in, as I know many people are, so you know it's not unique, but we're putting lots of tips in for how to help your dogs, painful dogs and other dogs and puppies, new puppies and cats during this lockdown phase, so that you can help them as much as possible, because a lot of dogs, of course, at this stage, we are encouraging you to walk your dogs frequently, short amounts with arthritis. That's become increasingly difficult to do. So you can look out, I'm sure Cam has some tips for that as well. There are also some coming out, pain tips on a Friday on the Longview Services Facebook page.
Wonderful. Well, we'll link all of this to this video, so you'll be able to go in and have a look at all what Sam's getting up to. But yeah, a massive thank you from me to you, Sam, for your time and for your expertise in this subject. I think it's been enlightening, and hopefully more people will consider using acupuncture as part of their approach to their pet's pain.
Thanks, Esme.
Thank you.